Okay, good morning, everyone. My name is Andrea Leonardi. I'm the Assistant Superintendent for Student Services for the Wilton Public Schools. And welcome to our webinar this morning. We are honored to have Dr. Eli Lebowitz from Yale here with us today. Dr. Lebowitz works, researches and studies and treats adolescent and child anxiety at the Yale Child Study Center. His research focuses on the developmental neurobiology and treatment of anxiety and related disorders with a special emphasis on family dynamics. Dr. Lebowitz is a lead investigator on multiple funded research projects, and he's the author of research papers, books, and chapters on child and adolescent anxiety. And he's also the father of 3 great sons. His most recent work, Breaking Free of Child Anxiety and OCD, a scientifically proven program for parents, is kind of the topic of today. This is sponsored by the Wilton Public Schools, along with Wilton Youth Council, SpedNet Wilton, and the Wilton Special Education PTA or SEPTA. So I thank them, all of our sponsors, for bringing Dr. Lebowitz back to Wilton. This is his second trip to us, and we look forward to hearing from him again and thinking about this work and how we can have a positive influence on our students or on our children. Just a quick note, we're going to be monitoring both the Q&A and the chat section for later on this morning. So if you have a question for Dr. Lebowitz, and you'd like to post it in the chat, I'll be processing those questions with him a little later on this morning. Also, Wilton Youth Council is sponsoring 2 book clubs that are going to focus in on Dr. Lebowitz's book. You can get more information on the Wilton Youth Council website, and all of these sites that are talked about today will be posted in the chat as we go. So you will see that. And with that, I'm going to turn it over to Dr. Lebowitz. Thank you for coming today. It is our privilege to have you here and welcome you back.
Well, thank you so much. It's an honor and a pleasure to be able to be with you this morning. And thank you to everybody who has taken time out of what no doubt is a very busy morning to join us and think about this topic of child and adolescent anxiety. So, and a special thank you, of course, to everybody involved in making this morning happen. Andrea, Genevieve, Kim, and all the others who really worked to, and sorry to the names that I'm not mentioning, who really worked to make this morning possible. So what I'd like to do is start out by talking a little bit about child and adolescent anxiety disorders and problems, and then focus more specifically on this book, Breaking Free of Child Anxiety and OCD, and on the role of parents and how parents and other caregivers can help children who are coping with anxiety-related problems to live a better life and function and feel better despite those issues. Now, even in the best of times, anxiety disorders are exceedingly common, and in fact are the most common mental health problem throughout development, really, in childhood, in adolescence, and even beyond, with current estimates suggesting that approximately 1 in 3 children is going to experience a serious, clinically impairing and diagnosable anxiety-related disorder at some point by the time they reach adulthood. And those are staggering numbers, speaking to the extremely high prevalence of these problems. But let's face it, these have not been the best of times. We are all living through a period that is unlike any other in our memory and really in our history. This whole entire past year seems almost designed or engineered to exacerbate anxiety problems. If you were to put together a panel of anxiety experts to diabolically think about how can we drum up business in the anxiety world, you might come up with a year a little bit like this one. Because if we think about the things that really contribute to anxiety and the things that are most difficult and challenging for any child or parent or adult who is vulnerable to anxiety, what are some of those things? Well, we know that children who struggle with anxiety don't do well with unpredictability, with uncertainty, with change. They tend to prefer the predictable because it's controllable, it feels knowable, and uncertainty makes anxiety worse when we don't know what to expect from one day to another. They tend to avoid change and to show a strong preference for the familiar, for the pattern, for the repetition over the spontaneous or the different and the unfamiliar. But think about those words, unpredictability, uncertainty, change. Those are maybe three of the best words you could come up with to describe this entire year, where life has changed for all of us so suddenly and for so long, where we really don't know what to expect from one day to another, where we don't have a sense of certainty and we're surrounded by questions, conflicting information, changing information and guidelines from one day to another, and where the things that make up the familiar structure of daily life have either been suspended, put on hold, or dramatically changed from how we knew them. The basic building blocks of children's day-to-day life. What does a day look like? Going to school, interacting with other peers, seeing their parents go to work and come back from work and do the normal things. All of those things, they've changed so much. And so it is not surprising that so many children are struggling during this period above and beyond the extremely high prevalence of anxiety that is always part of the landscape of children's mental health. And for some children, the hardest point actually comes when things are shutting down, during those moments of lockdown, when life is abruptly changing so suddenly. But for many children, in fact, probably for even more children, the hardest part actually is coming now, when we are asking children to pick up those threads of daily functioning, to resume the challenging activities of daily life. And so it's actually not surprising that so many children are actually struggling today, and often more so than we might have seen during the moments of more intense lockdown. For example, for a child with social anxiety, a period of lockdown may actually feel like a relief. When I don't have to meet face-to-face with other people, when I can be seeing people only over Zoom and maybe with my camera off. But then when we ask that child to walk back into a crowded classroom with everybody looking at them, to speak in front of other people, to have people speak to them and interact in the yard and play, etc., that can seem daunting. Or for a child with separation anxiety, who is worried or scared and afraid when not being very next to their parents, a period of lockdown may seem like a haven from separation because we're all stuck in the house together, nobody's going anywhere. But then when we ask that child to resume the daily separations with maybe parents going back to work or children going back to school, that can feel daunting and even overwhelming. And so on for the other anxiety problems. And so just to say that it's really to be expected and not surprising that we are witnessing a real surge, a wave of child anxiety and other related mental health challenges. Now, when we talk about anxiety problems, there's really a very broad range of anxiety problems, from the normal anxiety that every child is going to experience sometime. And it is important to remember that anxiety itself is not a disease. It is a normal, healthy part of life. We expect everybody to feel anxious some of the time. And just like you could have too much anxiety, you could even have too little anxiety, because our anxiety system is there to keep us safe and keep us out of trouble. And every child is going to be anxious some of the time. And so, the first time your child comes to you and says, "There's a monster under my bed," you don't need to give them Prozac or even get them into therapy necessarily, because children are going to go through periods of normative developmentally expected anxiety. Young children are often afraid of the dark, or of animals and monsters and things like that. A certain amount of social anxiety is to be expected in adolescents, for example, especially when contending with a new environment. And so, if we were to go into a classroom in the first week of the first year of junior high school, we may find that lots of kids are meeting criteria for social anxiety disorder. But a few weeks later, most of them are going to be doing better. And so there's this really big range from the normal to the concerning, and all the way to the clinically impairing anxiety disorders. We consider an anxiety problem to be clinically meaningful, diagnosable, and requiring specialized treatment when the anxiety has become a somewhat stable fixture of this child's life, and over a period of at least weeks and often months and often years, and when the anxiety is exerting a problematic influence over this child's ability to function in an age-appropriate way across the various domains of functioning that are relevant to a child's life. So, for example, functioning in school. Maybe that's attending school, maybe that's achieving academically, maybe that is interacting with other people in the school. Or the domain of social interaction, when the anxiety is impairing a child's ability to make and maintain peer relationships and friendships. Or when it's impacting family life in a significant way, maybe causing disruption to the daily functioning of the family, including parents, siblings, and of course the child themselves, or maybe causing conflict and stress within the family dynamic. And finally, we think about impairment at the personal level of the child's own function and well-being. And that includes both their ability to just function physically normally, including things like sleeping at night, eating normally during the day, feeling physically okay, because excessive anxiety over periods of time can exert a real influence on a child's physical well-being. For example, causing fatigue, causing aches and pains, belly aches, headaches, persistent nausea, backaches, things like that, and also their emotional well-being. So just to be able to feel okay about themselves, to feel relaxed at least some of the time, to take pleasure in the things that they may enjoy. And the more impairment that we see over the more time across these various domains of functioning, the more likely we are to consider this child's anxiety problem to be a clinically impairing anxiety problem. And those are the problems that we currently estimate at a prevalence of 1 in 3 children at some point by the time they reach adulthood. So not the, are you anxious some of the time about something? Then we would be saying approximately 100% of children, but the actual clinically impairing disorders. Now, we have had for years now, mainly 2 evidence-based approaches to treating these serious anxiety disorders, including specific phobias, meaning strong irrational fears of just about anything, But common phobias include things like fears of animals, fears of heights, fears of needles or blood or injections, fears of storms, things like that. These are common phobias, but really anything could be the focus of a child's phobia. Other anxiety disorders include generalized anxiety, which refers to really chronic, persistent, interfering, and uncontrollable worry. So generalized anxiety disorder is a little bit like having an antenna on your head, and it's just tuned to pick up things to worry about and then run with them. So a child with generalized anxiety may, for example, hear something worrying on TV, like an article about cell phones and a possible link to cancer. And then their brain may just kick into overdrive, churning away, worrying about all the people they know who use a cell phone. And that's pretty much everybody that they know. And so is mom going to die? Is dad going to die? Am I going to die? Is grandma going to die? Are we all going to die? And this can just keep you up at night with these thoughts running through your head. And maybe the next week you hear your parents arguing, and now your brain kicks into that. And it's, wait, are my parents fighting? Are they going to get divorced? Who am I going to live with when they do get divorced? Am I going to have to move house? Will I have to go to a different school? And now you're lying in bed all night with those thoughts running through your head. And then you want to buy something and your parents say it's expensive. So you're worried, wait, do we not have enough money? Am I going to lose my house? What's going on? Etc. This is exhausting. It really is physically exhausting. One of the things about generalized anxiety is that it really robs you of the opportunities to recharge your batteries and sort of fill up your resources and reservoirs of energy, both physical and mental, because it's often at the times when you would be relaxing that the thoughts come up the most. Another common anxiety disorder is social anxiety disorder. It's like an extreme kind of shyness and extreme preoccupation with what other people think about you. And this can really get in the way of any kind of social functioning. Children with social anxiety disorder are not disinterested in other people. They may wish they had friends and long to interact with other peers, but they'll often put a lot of work into staying away from any chance to actually be with those friends because of the fear that the event will go poorly, that maybe I'll not know the right thing to say, or my jokes won't be funny, or they're going to think I'm dumb, or I don't know how to walk because I'm not sure where to put my hands when I'm walking, and they're all going to look at me like I'm a fool, etc. Another common anxiety disorder, especially in younger children, is separation anxiety disorder. And that's not just the fear of, I don't want my parents to go off for a weekend. It can also be, I don't want to be in another room from them. I need to maintain constant eye contact with them. I can't close the bathroom door when I'm using the bathroom because I won't be able to see them. I can't sleep in my room at night because I have to be with them all night. These are really the most common anxiety disorders, and I'm going to include in the list also obsessive compulsive disorder, which is tightly linked to anxiety, and that is when children experience some combination of intrusive thoughts that come unwanted into their mind, almost like somebody else is putting the thought in their mind, and those thoughts cause them significant distress and will often lead them to engage in compulsive behaviors. These are ritualized, rigidly scripted kind of behaviors. So for example, a child may have obsessive thoughts about germs or contamination, and then may engage in compulsive rituals like excessive hand washing or cleaning rituals. And sometimes there isn't even that logical connection between the thoughts and the compulsions. So for example, a child may have thoughts about mom having a car accident and engage in hand washing behaviors, even though that doesn't seem to make the same kind of sense. It helps them to feel less distressed by the thoughts. And finally, I'll mention panic disorder, which is characterized by repeated panic attacks. And a panic attack is an extremely unpleasant experience. It's not dangerous. And this is an important thing to know about panic attacks, that they themselves are not physically dangerous to a child. Any child who can run a quick sprint can also safely have a panic attack, because your body is doing pretty much the same thing in both of those situations, right? Your heart's racing, your breath is coming fast, you might be trembling a little bit, you'll feel out of breath, maybe a little lightheaded, but it's not an actual physical danger. But because it can happen suddenly and unexplained, it can be very frightening and unpleasant and will often be accompanied by very scary thoughts like I'm dying or I'm losing my mind. And this can make children very scared of having more panic attacks, which is really the heart of having panic disorder. It's worrying about what if I have another panic attack, and then increasingly avoiding situations where I might have a panic attack and not being able to function normally as a result. And so for decades now, we have had mainly two treatment approaches for treating child anxiety disorders. There are more than two, but there are mainly two approaches that have been well supported by empirical research through clinical trials that show their efficacy. And those are, at the psychotherapy level, cognitive behavioral therapy, which is really a treatment that's done directly with the child and teaches the child a set of skills for better managing their anxiety. And those skills focus on identifying anxious thoughts and labeling them as such, and then challenging those thoughts by asking questions like, how likely is that to actually be real? Or how awful would it be if that actually happened in reality? And so getting good at catching the ways that anxiety is trapping you into patterns of anxious thoughts and modifying those patterns. And the other key skill of cognitive behavioral therapy, or CBT, is practicing exposure, which means purposely putting yourself into contact with the situations that trigger your anxiety that are not realistically dangerous to you, but that make you scared. So for example, for a child with a phobia, that might mean practicing coming into contact with the thing that they are scared of. Like if you're scared of heights, practicing going to increasingly high places, not in a physically dangerous way, but in a way that triggers your anxiety. And that is one of the two main methods that have been around and well supported by research. The other is psychopharmacology, meaning medications. There are multiple clinical trials speaking to the efficacy of medications for treating anxiety. And I don't want to go too deep down the medication rabbit hole, but I will say, because it's important to know, and it's very confusing, it's often very confusing to parents, that the medications that are used to treat anxiety are actually, somewhat confusingly, not the medications that are called anti-anxiety medications. And I know that this is a source of tremendous confusion for a lot of people. The medications that we use to treat anxiety much more commonly are actually called antidepressants. And this is not because they're only used for depression, but it's because they were first used for depression. And anti-anxiety medications are medications that do in fact reduce anxiety, but they are somewhat sedative, meaning they are a little bit tranquilizing. And they also have an increased risk of side effect or needing higher and higher doses over time and more difficulty with withdrawal when you stop those medications. And so we usually don't recommend, especially as a frontline option, treating anxiety with anti-anxiety medication, but rather we use antidepressants, which are equally anti-anxiety medications, despite the name. Okay, so we have these two well-established treatments, and I do want to say that the recommendation is almost always to prefer psychological treatment, especially cognitive behavioral therapy, over the use of medication, especially if a child has not yet received cognitive behavioral therapy in the past. And even when a child is receiving medication, most researchers would agree that the child should also be receiving psychotherapy and not relying only on the medication to treat the anxiety. Now, as I've already noted, there's a lot of research about these treatments showing their efficacy. And so we know that they can work. However, we also know that they do not work for everyone. And so if you are a glass half full kind of thinker, a more optimistic thinker, then we have very good news. And that is that between these two medications, we can usually effectively treat at least half, approximately half, maybe a little bit more even, of children who will get these treatments. About half of them will have a really good response, and another 10 or 15% will have a somewhat good response, but maybe not as good. On the other hand, if you're a half glass half empty kind of thinker, then you may also realize that that leaves a tremendous amount of children who are not actually going to benefit sufficiently from these therapies, which leads to the question, what else can we be doing to help anxious children? And here is where I want to focus more on the parent side of the equation. And the role of parents in child anxiety is actually a really important one. And this is, I want to be very clear that this is not because we believe that parents are the cause of children's anxiety problems. In fact, parents are not the cause of children's anxiety disorders in almost every case. Putting aside serious bad behavior by parents, such as physical or emotional abuse, neglect, and maltreatment, those, of course, can have a seriously bad impact on a child's mental health. But that is not the story for the vast, vast majority of children who have an anxiety disorder. Very few of them will have that problem because their parents were so horrible to them. Much more commonly, a child is going to have an anxiety problem because they were born with the predisposition and vulnerability to anxiety. And so the reason that parents are important in the equation is not that they are the cause of the problem, but rather that they can be a huge part of the solution for the problem, and the fact that children naturally rely on their parents when they do feel anxious. And this has to do with our basic nature. Children, like all mammals, are born not very well prepared for life. And so when we are born, when we are young, when we're babies and when we're children, when we feel threatened or scared or worried, our natural response in childhood is different from an adult response to anxiety. In an adult, we see primarily an individual response, the classic fight or flight kind of response. I'm going to either face this threat or I'm going to run away and avoid this threat. But children are not very good at fighting off threats, and they're not very good at self-regulation and soothing, and they're not very good at running away either until a certain age. And so the natural response in childhood to fear is actually a social response. It's an interpersonal response that looks to the parent for help in avoiding the threat and in soothing and calming and reassuring. And parents are also naturally hardwired and motivated to detect the cues of anxiety in their children and to respond to those cues, to step in when their child is anxious and provide protection and also soothing and reassurance and calming and regulation. And what this means is that a child's anxiety problem naturally involves their parent. So when a child has an anxiety disorder, it's not only the child who has the anxiety disorder, that problem actually lives in that interpersonal space between parent and child. And this means that parents have a lot of opportunity, almost inevitably, to be responding to their child who is anxious. Whether it's your child with social anxiety, who is hiding behind you when someone speaks to them because they are uncomfortable speaking for themselves, or your child who has generalized anxiety and is having all of those worried thoughts running through their mind, they are likely to come to you, the parent, and ask you questions about their worry. Or it's the child with separation who is begging you not to leave them alone and to sleep next to them at night or keep that door open, etc. And all of these moments provide parents with endless dilemmas and challenges about, okay, how should I be responding? Should I be pushing my child to face their fear, get a grip, suck it up, overcome the problem, etc.? Or should I be helping my child to avoid this because it's clearly making them anxious? And we have studied these questions in a lot of depth and over many studies. And what we find is that the natural response of parents is to engage in what we call accommodation. And what we mean by accommodation is that the parent is changing their own behavior to help their child feel less anxious. So when your child is worried and comes to you with a question, that's their anxiety symptom. When you respond to that question, when you tell them again and again, no, you're not going to get sick. No, I'm not going to get cancer. No, we're not getting divorced again today either. No, we're not losing our house today either. When you keep answering those questions, that is your accommodation. When your child is scared to sleep alone at night, that's their anxiety symptom. When you lie next to them in the bed, because they're scared, that's your accommodation. Or when your child is anxious and doesn't want to answer the waiter in the restaurant and looks away and won't talk, that's their anxiety symptom. When you speak in place of them, that's your accommodation. Now, over many studies across the world, what we find is that almost every parent who has an anxious child engages in frequent accommodation, because that really is our natural response. But what we also know from a lot of research is that these accommodations, although they are well-intentioned, and although they can help in the moment to help your child to feel a little bit less anxious or get through that moment of the day, they are actually not helpful over time in helping your child to become less anxious. And in fact, the opposite of that is true. And so as parents accommodate more, what we actually see is a child who is increasingly dependent on the parent for accommodation and increasingly more anxious themselves. And so the symptoms actually tend to get worse over time rather than better, which is almost heartbreaking because parents may be pouring tremendous time, resources, energy, and even money into trying to accommodate this child in the hopes that the child will finally be less anxious, and yet tomorrow the child is just as and often more anxious. So we know that accommodation is actually not the solution. And what I'd like to lay out now is, well, what is an alternative to accommodating my anxious child? Because when they are coming to me with that question, or they are scared at night, or they are worried or not speaking, etc., I have to respond somehow. And so what is an alternative to accommodation? Well, we would suggest, and this is backed up by significant research, that the best alternative is what I'm going to call a supportive response to an anxious child. And what do I mean by a supportive response? You're being supportive as the parent of an anxious child when your response to your child who is anxious is showing them two really important things. And it's only support when you're able to show them both of these things. One part of the supportive response is a message of acceptance, validation, and acknowledgement of your child's genuine distress. This can be as simple as saying to your child something like, I get it, this is hard for you. Or, I get it, this makes you anxious. It's uncomfortable or it's scary. Simply accepting that that is what your child is genuinely feeling. There's no risk in accepting. Your acceptance of your child's anxiety is not going to make the anxiety worse. And not accepting what they're experiencing is not going to make the anxiety go away. So if your child says it's scary and you say, oh, no, it's not, you may think that you're making the anxiety go away, but it won't. What you are doing is not being supportive and leaving your child feeling not believed or not understood. And so one part of the supportive message is simply that acceptance, that validation and acknowledgement. The second part of the supportive message is a vote of confidence in the child's ability to tolerate, to cope with that distress. This can be as simple as saying, I know that you can handle it. I believe that you can get through it. You don't have to convince your child to agree with you. That may be an unhelpful argument to have with your child. You're simply telling them what you believe. Now, when you put these two things together, that's when you get a supportive statement. So it could sound something like, I understand that this is really scary for you, and I believe that you can handle that feeling, that you can get through it. That's what we mean when we talk about being supportive. Now, the book that was to some extent a stimulus for this encounter this morning, called Breaking Free of Child Anxiety and OCD, is really a step-by-step program to take these very fundamental kind of ideas of increasing your supportive responses to your anxious child and systematically decreasing in a loving, caring, and supportive way your accommodations of your anxious child, and take those ideas and put them into action, into practice. Because simply saying, as I'm doing now on this webinar, simply saying, be supportive or don't accommodate, that's not a full treatment. That's not a full solution, because you're going to run into challenges like, which accommodation should I be stopped? Should I just stop all accommodations at once? I'm probably not able to do that. So how do I pick? And how do I actually make that happen in real life? And how do I handle it when my child gets upset when I don't want to do the accommodation? What if they get even more anxious in that moment? What if they get angry at me in that moment? What if they say, you don't care about me anymore in that moment? These are hard things to deal with. And what the book does is really take these ideas and translate them into a step-by-step workbook for parents to work through this treatment on their own. And this actually is a real treatment. The treatment is called SPACE, which stands for Supportive Parenting for Anxious Childhood Emotions. And it focuses on those two things that I've just laid out, meaning increasing supportive responses and decreasing accommodation. And we and others have conducted clinical trial research on SPACE, on this treatment. And the evidence shows that when parents are able to make these changes in a systematic, consistent way, that actually is an effective way of treating child anxiety. In fact, in one randomized controlled trial, for example, we compared the efficacy of doing this treatment SPACE with parents of anxious children to the efficacy of doing cognitive behavioral therapy, a very well-established treatment, directly with children. And in that study that involved over 120 clinically anxious children, half of the children were randomly assigned to receive cognitive behavioral therapy. So they met directly with a therapist for 12 sessions of very good CBT. And the other half of the sample were randomly assigned to receive SPACE. And so the therapist met only with their parents and actually never met with the child directly at all. And what the results showed, and these are results that have been published in the Journal of the American Academy of Child and Adolescent Psychiatry, a leading journal in the field, what the results showed was that doing SPACE was just as effective in treating child anxiety as working directly with the child. And this is really important news. A, because it means that we have another treatment option, another alternative in our toolbox for helping anxious children. And B, because it means that we have a treatment that actually doesn't require direct participation of the child. Because one of the limitations of a treatment like CBT is that it really requires a high level of motivation and engagement and collaboration on the side of the child. CBT is not a treatment you do to someone. It's a treatment you do with someone. It requires a child to be willing and motivated. SPACE actually does not require that. It is wonderful when you have a very engaged and motivated and collaborative child. But SPACE was designed from the beginning to be able to be implemented even when you have a child who's not on board at all. Maybe they don't think they have an anxiety problem, or maybe they are too anxious to want to do something about the anxiety problem. And this is actually a common scenario. And so it means that we have a treatment that actually doesn't require direct motivation and participation on the part of the child. And one of the promises that I make to parents in SPACE is that throughout the entire treatment, you're actually never asked to force your child to do anything. You don't need to get your child to practice a skill or face their fear or do this, that, or the other. And you also don't need to make them stop doing anything, because the focus is entirely on how you, the parent, are responding. And it's really about showing the child through my behavior as the parent that they are able to tolerate anxiety. Once an anxious child learns that they actually can handle feeling anxious, they're actually well on the way to recovery, because most of the impairment in anxiety disorders stems not just from the fact that I am more anxious than other children, but from the fact that I don't want to feel anxious. That's what drives the avoidance of situations that may trigger anxiety. That's what drives the impairment to my functioning across those domains that I laid out earlier a few minutes ago. So I want to leave time for questions, and I'm going to stop just by reading you, if you'll permit, one brief paragraph from the book that I think captures some of the essence of what we are talking about. So this is the book, Breaking Free of Child Anxiety and OCD, and I will read just one brief paragraph and then take questions in the remaining time. Helping your child cope with difficulty is one of the most important aspects of being a parent. From that first time you held your infant for a shot, to insisting she go to bed at night, to making him go to school in the morning, parenting is often about making tough choices. Providing too much accommodation for children's anxiety can be like telling them that they don't need the shot after all. It will help them feel better in the moment, but will put them at greater risk in the long term. Ask yourself this question: what is the most important thing for a child who's vulnerable to anxiety to learn? I believe the answer is that the child can cope with anxiety and know that it's okay to feel anxious some of the time. After all, if your child is likely to experience a lot of anxiety in life, then the last thing you would want her to think is that she can't handle it. We want our children to believe that they can cope and to learn skills for coping most effectively. Thinking about anxiety like this makes it clear that an important job for parents of anxious children is to instill in their children the knowledge that they're capable of coping with anxiety. Okay, I will thank you for your attention over these minutes, and happy to try to address as many questions as we can cram in to the remaining time.
All right, thank you, Dr. Lebowitz. All right, so I have a question from a parent. What do we do if a child is resistant to relaxation techniques? Breathing, taking walks, mindfulness, etc. Tends to say things like, that doesn't work. It's hard to de-escalate the situation. This parent knows that the child that the anxiety tends to resolve in about 20 minutes, but those 20 minutes can be very difficult. Can you give some thoughts on that?
So I will give two points on this. It's a great question. Forcing your child to relax is a little bit like yelling at your child to fall asleep. It does not work. You can't be forced to relax. So first of all, give it a break. Take a break. Don't mention relaxation for a few weeks at least, to try to clear the air from some of the negative allergic response that your child may have now developed to even the suggestion. Model relaxation on yourself instead. Take some time, maybe when your child is around, you can just say, Mom or Dad, I'm taking a few minutes now to relax for me because it helps me to de-stress. And just show them that without a request that they do it as well. Number two, maybe try having somebody else suggest it to them. And I know that it hurts when you as the parent can't be the one to make all the suggestions, but the fact of the matter is there's lots of kids who will be open to a suggestion that comes from someone else, but won't be open to the very same suggestion that's coming from Mom or from Dad. So you may want to try having somebody else do it. And the last thing I'll say is, let them live through those 20 minutes. That's not a terrible thing. When I feel rushed to make sure they're doing something to abort the 20 minutes, to make sure that it ends sooner, I'm also giving a message that anxiety has to be removed and avoided at all costs. When I say a supportive statement, like I described before, wow, I see that you're really upset right now, and I'm sure you'll feel better soon and you'll be okay. I'm giving the message, it's okay to be anxious some of the time, and I'm not getting into a power struggle of how am I going to get you to relax, which is something that is doomed to fail.
Thank you. Another parent writes, I love your book and I'm using it with my son who was recently diagnosed with OCD. I'm struggling with knowing what is within my child's control in order to provide support. What is the line of a reasonable request as parents versus an avoidance, accommodation, or acceptance due to anxiety? We're trying to determine what is not within his control to rule out adolescent behavior as opposed to obsession.
Okay, it's a little hard to answer because I'm not sure of the kinds of like examples maybe or things that we're actually focused on. But what I would say is, first of all, try to pick a focus in terms of like changing your behavior. Try to pick a focus that really involves what you do. In other words, think over, and thank you about the book. I'm glad that it's proving useful and that you like it. But if you really look over the chapter on choosing a target, you'll see that the focus is really on the things that I am doing, as opposed to getting my child to change their behavior. So try to really be strict about picking a focus that's on me, because that way the issue of control becomes a little bit less relevant, right? If it's about my behavior, then the issue of what the child can control becomes a little bit less relevant, or a lot less relevant, than if I'm thinking about a child behavior. And I wish that I could give a better answer than that, but I'm just a little vague on like the kind of issues that the parent is facing, so it's hard.
Okay, I have a couple of questions that are in the same vein about kind of performance anxiety in high high performing kinds of places, and the impact of that highly competitive culture. And then a parent adds on the anxiety around taking exams. So perhaps you can talk a little bit about supportive parenting in that kind of environment.
Yeah, I mean, this is a very common story, I think. We live in an age that's very focused on achievement, and especially academic achievement, and there are many families that are extremely achievement-oriented, and children absorb this. And some are intrinsically, naturally inclined that way, and some really absorb it from the environment, from teachers, from parents, from siblings, etc., and become very concerned about achievement, sometimes even beyond what their parent may require. One thing I will say is, you have to practice what you preach a little bit when it comes to messages about achievement. Meaning, if in my own life, when I'm coping with something at work or at home, or when I'm coping with something, if my behavior shows that I think things have to be pretty perfect, then it becomes a little bit less believable when I say to my child, just do your best, and it's fine. Mom and dad will love you regardless. You don't have to worry about it. If I can't accept in myself anything less than perfect, then that message loses a little bit of its credibility. So one message that I give to parents is take a look at what are you modeling, and not only what are you saying. Now, in terms of supportive responses, the focus of the supportive response is on the experience of the child, not on the actual like performance. And so what I want to be saying to the child is not like, it's less about you can be okay even if your grade is not perfect. It's more, I know that the thoughts you have are really uncomfortable. I know that the worry that you have about achievement or performance or what have you is really uncomfortable and distressing to you, but I know that you can handle those feelings. And it's less about what are you actually going to do? Are you going to get the best grade, or are you not going to get the best grade? And children will pull very strongly back to the conversation that their anxiety is driving them to have. So they'll be like, yeah, but what about if I don't get the grade? And there's a very strong pull to focus on the actual behavior, but I would try to like keep my focus as the parent on the anxiety, meaning, yeah, I see. That's just another thought. It's another one of those thoughts. And I know that you can handle it. And the last thing I'll say is it is okay not to answer every single, not to, throw back every single ball that your child lobs at you. And so sometimes it's okay to say, I think I've answered already, and not to continue engaging in the discussion, because it can lead to a lot of frustration and irritation when you're trying to give your supportive message, but your child really wants to hear something else from you. And so they keep asking again, and you keep giving the message that's not exactly the one they want to hear. And a better strategy is to say what you have to say, and then just leave it. at that, even if they're not completely satisfied.
Dr. Lebowitz, there's a few questions around, can space be used with teenagers, not just children? Can you respond to that?
Yeah, very good question. The answer is yes. The answer is yes. So the clinical trials for space have focused primarily on children from quite a young age and through mid-adolescence, so like 14, 15, that age range. But in clinical experience, so working outside of the clinical trials, we also have a lot of experience doing space with children who are older than that, including 16-year-olds, 17-year-olds. And there's even a version of space that we use for parents of adult children. And that's like its own topic that we could talk about for a long time, so I won't get too far into it, except to say that there are some adult children who experience what we sometimes call failure to launch, meaning that they're not able to transition to like functional adulthood and to move out or be in higher education or employment or things like that, and remain stuck in their parents' home and very dependent on parents and a lot of accommodation, and that's often driven by anxiety. And there's a version of space that we actually do for that. We're actually doing a clinical study of parent-based treatment for so-called failure to launch now, and if people want information about that, they can reach out and I can direct who to contact. But the short answer to the question was yes, you can do space even with older adolescents. I would say it would be important to think about accommodation is sometimes going to be a little bit less huge in the older adolescents, so we want to take a look at it and also think about the ways that parents are responding along the lines of support. But yes, you can do it also with older kids.
I have a question. This question is coming from a clinician on what to say to parents who feel as if this approach seems to blame parents for their child's anxiety and might make parents feel like maybe others don't understand what it's like to parent a child that has severe anxiety.
Well, number one, I'm the parent of 3 boys. All of them are anxious some of the time, and one of them is a very anxious child. And I speak partly as a doctor and a researcher who's focused on it, but also as a parent. And the last message that I would give is, this is your fault as a parent. I simply do not believe it's true. And I do want to say that I'm keenly aware that mental health as a field, including psychiatry, psychology, social work, we have a very rich and rather shameful history of blaming parents for children's mental health problems. Parents have been blamed by mental health professionals for many problems in mental health of children, including schizophrenia, including autism, including anxiety, including eating problems, including many other things. Time and again, empirical research fails to support those theories. No serious researcher today believes that parents cause schizophrenia through their behavior, or that refrigerator mothers, so to speak, cause autism. And I do not believe that parents are the cause of children's anxiety. Read the book, really, because I actually go into this at some length in the book to try, in 2 places actually, to try to dispel this myth. I believe that parents can be instrumental in helping their children overcome anxiety. I don't believe they're the cause, but I believe that if you are the parent of an anxious child, how you respond matters. Just like if you're the parent of a child with diabetes, you didn't give your child diabetes. If you're the parent of a child with a food allergy, you didn't give your child a food allergy by being a good parent or a not good parent, right? Nobody thinks that. But how you respond is going to matter to how well they do. And this is true for anxiety also. So I would say it's the furthest thing from what I believe to blame parents for their children's anxiety. What I also will say is, once we've put that aside, once we've done away with that myth of parents are the cause, it is actually tremendously gratifying and empowering as a parent to be able to help your child overcome a serious problem. And why should you only help them with problems that you caused, right? Like, why would you only want to help your child with a problem if you caused it, right? Like, that doesn't even make sense. Once you do away with that myth, as I really try hard to do, I I think it's a wonderful experience. And I also think it's a wonderful experience for a child to have had a problem and to have parents who knew how to help her. I think that's a beautiful thing. And so all I can say is, please believe me when I say I'm not, that this treatment is not blaming parents for their children's anxiety problems. Far from it.
Okay, we have, I think, time for one last question. This question speaks more broadly to the community, to say, with the prospect of 1 in 3 children having a clinically impairing diagnosis, which the pandemic has now exacerbated, what advice do you have for families regarding academic expectations in the year to come? And what guidance can you offer our district leaders concerning expectations we put on children within the classroom environment in that same vein?
Yes, I mean, it's a tricky question, and one that, you know, we really have to be thoughtful about. I do want to just make sure that I'm clear. When I say 1 in 3 children, I'm talking about at some point before adulthood. I'm not saying that 1 in 3 children today have an anxiety disorder. The statistics for today are probably somewhere between 5 and 10% of how many children right now have. But approximately 1 in 3 will have an anxiety disorder at some point. I just want to make sure that I'm not giving the wrong, sense, because these statistics can sometimes be confusing. But that doesn't change the fact that it is a huge number of children and that schools are going to be contending with this. I think we have, to be very honest, I think we're going to be feeling our way a little bit as we get back into the swing of things, just like we had to feel our way with, like, how do you do school during a pandemic? What does Zoom school look like? And schools have been figuring this out, and districts have been figuring this out throughout this whole year. And that is also going to be true as we go forward. And I wish that I had, a pre-cooked recipe for exactly how to handle post-pandemic academic expectations. But the truth is, none of us have been through this before. And so we're going to be feeling things out. And so what I suggest is less of a cookbook recipe kind of thing and more of guiding principles. And guiding principles should be, we should be patient and we should be gentle, because children are coping with a lot and we shouldn't be dismissing that. We should be dismissive of it. On the other hand, the idea that relaxing expectations is the solution to every child's problem is misguided. That is not always going to be true either. And so I think what we need to be doing is thinking about things on an individual level. This is not going to be a one-size-fits-all kind of answer. We need to be seeing what is driving a child's difficulty, and then trying to tailor our responses as much as possible for each child's difficulty. I think expectations need to be there. Children actually do better when there are clear expectations. And so it's I would say we'll probably do better, even with a lowered expectation, we'll do better with a clear guideline of what is expected than simply sort of, turning blind eyes along the way, right? Like where you're saying, okay, this is hard, so like we'll let that slip, we'll let that slip. That doesn't tend to work as well as sitting down and thinking, okay, what is a reasonable expectation for this child? And then making that clear to the child and trying that for a while, and then taking some time after that and sitting down again and saying, is that working, or do we have to make a change? Because clear expectations actually help anxious children to often do better, rather than a kind of vague, I can get away with stuff sort of approach. But I honestly think that this really is something we're going to be figuring out together as we wrap up this school year and head into the to the next one.
I agree. Well, I know you have a hard stop at 11 o'clock, so I want to make sure we acknowledge and honor that. And I just want to take a moment. There are a lot of thank yous in the chat and thank yous in the question, thanking you for your time today and how helpful this was. We do have more questions than we're able to answer today, but I would strongly suggest those of you who are asking the questions, particularly the ones specific to your child, I would sign up if you're Wilton residents for the book clubs that are coming. I think those will be places of support for the what if, and I'm going to try something and come back with some feedback and get some support from the group. So those will be facilitated by folks who've had this training, and we'll be able to, further those discussions as you read the book together, and put into action many of these techniques. So with that, I would say thank you to Dr. Lebowitz. As always, I learned a lot, and many of us learned a lot to take away and take back to help out our kids. So we really appreciate your time and your work, and look forward to the next time you come back to Wilton.
Well, it's my pleasure and my honor to be able to do it. Thank you to everyone who participated. Thank you to everyone who organized. Many of the questions, just glancing at the chat, many of the questions actually are addressed in detail in the book. So I hope that it will be, I'm sorry I couldn't get to everybody, but I do have another meeting. But yeah, thank you again for having me, and enjoy the rest of the day.
Thank you so much. Bye, everyone. Be well.